So it's hot. 97 high today. Sunny skies overnight, muggy and 71. Partly cloudy tomorrow with a chance of evening storms, 96 for the high. Another muggy 71 overnight. And on Thursday, we're going to have a sunny day. Slight chance of storms after 2 p.m. Going up to 97. Closing out at 73. Time for final traffic, Chuck.
From the UCL Traffic Center at the UC Gardner Neuroscience Institute, you can access the leading brain, spine, and nerve experts right here in Cincinnati. Heavy traffic southbound 71 from above Fields Erdel, past an accident at Red Bank left shoulder to the lateral. That's over an extra half hour. Southbound 75, brake lights in and out of Laughlin. Northbound 75, add an extra 20 minutes between Turfway and Town. Northbound 471 backs to Grand. Inbound 74 getting better. Chuck Ingram on 55 KRC, the talk station.
848, 55 KRC, the talk station, and a very happy Tuesday to you. This is going to be great, folks. There's nothing great about osteoarthritis, but I have Dr. Matthew Bertke, and he's been on the program before. He's one of the great doctors at OHC, my cancer doctors. But we're not talking about cancer today. Dr. Bertke, who's a radiation oncologist, led the initiative for my friends at OHC to offer this treatment for folks suffering with osteoarthritis. It's called low-dose radiation therapy. Doctor, great to have you in the studio. What a fascinating topic. I'm sort of glad we're not talking about cancer, as enlightening as everything you bring to the studio when we talk about cancer and your developments and treatment protocols. But you can deal with people's osteoarthritis with this radiation therapy?
For sure, yeah. It's great to be here, Brian. Thanks for having me.
Oh, always a pleasure.
So the same kind of radiation machines that can deliver radiation for cancer at much, much lower doses, we can deliver radiation that is actually anti-inflammatory and can treat osteoarthritis.
Now, is this all brand new? I mean, is this some kind of oh my God, we just discovered this kind of thing? Because I've literally, not that I'm a genius on this kind of stuff, but never heard of the concept.
Yeah, I don't blame you. It's something that's not been very common in the States, but it's not new. It's something that's been used for decades, more so in Europe, but in the past 5 or 10 years, it's been gaining a lot more traction to be used in more places across America. And we're trying to bring it here to Cincinnati to make sure that people have another option.
Well, I know you, and I know the folks at OHC, and you wouldn't be bringing this technique and this methodology to the practice if it wasn't demonstrably beneficial. There have been studies on this, I have to imagine.
For sure. There have been large studies with thousands of patients looking at how effective it is and how safe it is. Overall, it's something that, is about 70% effective. That means 7 out of 10 patients can benefit from it, which is pretty good in terms of response rates compared to things like injections. And it's something that's very safe as well.
So you said injections. I'm immediately thinking of a knee or a hip. My dad had to have both replaced at one point in his life, but I remember him going through that injection protocol. Is that the kind of, treatment you would use on a knee or a hip or other areas where people might be struggling with osteoarthritis?
Yeah, so this low-dose radiation that we use can be used in almost any joint in the body. So hands, knees, hips, shoulders, even the spine.
Now, how quick does it take to, notice a change for the better? You say it's 70% effective. Effective meaning on a spectrum. Are you going to be cured, or is it reduced pain, or how does that work?
So it's not something that's going to cure you, or it's not going to turn your knees back to 20-year-old knees. So if you've got bone on bone, it's not going to stop that, but it can reduce a lot of the inflammation that's being caused by the breakdown in the joints. So we look at 70% effectiveness, meaning that the pain is going down, or you're not requiring as much pain medication, and better quality of life.
Well, getting rid of pain medication is one great benefit in and of itself, because we all know what a problem that is. Now, who's eligible for this? Is it just literally anybody who has a diagnosis of osteoarthritis?
So it's got to be osteoarthritis. So it's not people with rheumatoid arthritis or autoimmune problems that are causing their arthritis, but the typical wear and tear arthritis that you think about. And we're typically treating older patients, around 50 and above currently. But certainly it's something that's available to a lot of people that suffer from this.
Thanks. You just threw me into an older people category. I really appreciate that, doctor. That was fun.
I'm right there with you.
What is the treatment entail? I mean, how many, is this one and done? You got to do multiple sessions? And I also want to ask, considering this is radiation therapy, I know some people who've got, knees, plural, and hips, plural, and other areas where they have osteoarthritis. Can you treat all of those areas in the same visit? So how's the process work?
Yeah, good question. So typically this is done over 5 to 8 treatments, and they're done on days that aren't back-to-back, so typically over a 2 to 3 week period. each treatment's pretty quick, maybe 10 or 15 minutes. And we typically start seeing response where people are having reduction in pain maybe halfway through their treatment or toward the end of their treatment. So it's not an immediate type response. And to your question about number of joints, there are many patients where we've treated multiple joints at once. So, both knees or things like that. We can certainly do that and save time overall.
Okay, so it's safe to do multiple locations in the same visit is really kind of what I'm trying to.
Correct. Yes.
Because I hear radiation, and I think lead vests and doing all that kind of stuff. So
yeah, it's a reasonable thing to think about, but the radiation that we use for arthritis is kind of fundamentally different than the radiation we use for cancer because it's orders of magnitude less intense. And it has different properties when you're using it at these very low doses.
All right. And the number of treatments obviously depends upon the patient and how they're responding to it.
Correct.
Okay. And what's the length of time in between treatments?
So typically it's maybe 2 or 3 treatments per week.
Like in a week?
Correct. So maybe like a Monday, Wednesday, Friday treatment schedule.
So you can have the whole battery of treatments done in 2 weeks.
Correct.
Just boiled down.
Correct.
All right. Just real quickly, describe how the radiation works to control and deal with this osteoarthritis pain.
Yeah, it's a great question. So at its heart, it's anti-inflammatory. So at these very low doses per day, the radiation, instead of using at high doses where it is used to destroy cancer cells, when you turn the dosage way down, you have anti-inflammatory effects on the cells in your body, kind of your immune system, that are causing kind of a cycle of irritation, and it's kind of turning that off at multiple points in the cycle. So the same idea as medications that are anti-inflammatory or even joint injections that are like steroids that are anti-inflammatory, it's working on the same pathways to try to reduce inflammation.
Well, since this sounds new to me, and I'm sure a lot of my listeners are going, God, this sounds what I want to try that. Is it considered standard of care now? Because you said Europe's been doing it for decades and it's only landing in America now, and here at OHC.
It is.
It's not considered experimental.
No, it's not experimental. It's in insurance companies' guidelines.
Really?
It's covered by the insurance companies. We've not run into any trouble yet. And more importantly, It's got a lot of solid data behind it with patients both in America and in Europe that have been treated, and thousands of patients showing effective, safe care.
Well, I know I have a lot of folks in my listening audience dealing with osteoarthritis. You have a feeling your phone's going to be ringing off the hook today, recognizing this treatment is out there and available thanks to you bringing it to OHC and, of course, my listeners. 888-649-4800, 888-649-4800. And you want to learn more about OHC, and of course, I thankfully turned to OHC after my cancer diagnosis. Find them online at ohcare.com where you have all the information. Dr. Bertke, it's been a real pleasure learning about this awesome new treatment. I'm glad you're able to bring it to OHC and my listeners.
Thanks for having me. Always good to be here.
It is always a pleasure having you on. You always give me an uplifting information, especially in a subject matter that is typically so bleak. Coming up at 8:56, 55 KRC Talk Station, you may get a chance to listen. George Brenneman talking about the meeting tomorrow night at the farm with Congressman Warren Davidson, and a special podcast that Joe's producing for Congressman Davidson involving the audience participation. Details at 55KRC.com. My conversation with tech editor Colin Medine from Breitbart, and of course the Daniel Davis Deep Dive. 55KRC.com. Get your iHeartMedia app while you're there. Tune in tomorrow for Judge Anna Napolitano, and have a wonderful day, folks. Glenn Beck's coming right up.
The 2024 election.
Vice President Kamala Harris. I'm clapping. You don't have to.
On 55 KRC.
Searching for your next car? Don't settle. Thrive. At CarMax, it's easy to shop online or in person. With upfront pricing and tools designed to help, finding a car you love has never been easier. Plus, you can sell or trade in your current vehicle with an online offer in minutes. No strings attached. Start shopping now to find a car you'll love at CarMax.com. CarMax, the way it should be.
Trust. Not everyone deserves it. Not everyone should have it. It needs to be earned. Your trust. And when it comes to accurate information about Ohio's safe and secure elections, where should you turn? VoteOhio.gov. VoteOhio.gov is the source for providing you with the facts and real information about elections. So no matter where you are, what you do, or who you choose, get the real facts about Ohio's elections. VoteOhio.gov, your trusted elections source. Sponsored by the Ohio Secretary of State, Frank LaRose.
Do you have relationship issues? With your bank? At General Electric Credit Union, we think you deserve better. Open a Thrive High Yield Savings Account and earn higher returns than a traditional savings account. And with our limited time introductory offer, earn 4.5% APY for 6 months. You deserve better. General Electric Credit Union. Bank with us. Introductory offer for new account holders depositing $25,000 or more in new money. Contact us for full details. Insured by NCUA. Membership eligibility available throughout the tri-state.